Now, atypical cervical vertebra. The atypical consists of three vertebrae. The first cervical, that is called as atlas. In the Latin term, it is called as Stilton, who supports the heaven, and that is why this also supports the heaven, which is the cranial cavity, and that is why that first cervical vertebra is called as atlas. And the second vertebra is called as axis vertebra, and the third typical vertebra, that is the seventh cervical vertebra, is the called as vertebra prominens. Okay, because it has the prominent spinous process, and that is why it is called as vertebra prominens. Okay, now we'll see the one by one features of atlas vertebra, axis, and the vertebra prominens. So first cervical vertebra, how you identify by the it is the first cervical vertebra, that is this, the shape of this vertebra is a ring shape. Okay, it is not having the shape of the typical vertebra, so it is having the ring shape. It does not have body or does not have any spine. Okay, so that is the three main feature. It is having the ring shape, does not have body, and it does not have spinous process. Okay, and this atlas has anterior short arch and posterior long arch. It has right and left lateral masses and the transverse process. Okay, so it has this anterior arch, long posterior arch, which forming the 2/3 of the ring. Okay, then it has this massive lateral mass and then the transverse process. Now when you see this anterior arch in the midline, the anterior arch on the anterior side has the anterior tubercle. Okay, and the posterior surface, you will find it bears is the oval facet for the articulation of dents. Okay, and forming the atlantoaxial joint. Okay, so posteriorly it has groove for the facet for the dents. Okay, then upper surface of the arch, you can see the posterior arch here. The upper surface is the rough one in the anterior arch. Well, see the posterior arch. The posterior will forming the 2/3 of the ring. Okay, and it is much longer and the thicker also than the anterior one, and it's posteriorly in the median plane also find one tubercle, and that will indicate the spinous process. That will resembles like the spinous process of this vertebra. Okay, and that is having the called as posterior tubercle. You can see here this is the posterior tubercle. Okay, then when you see this surface, the superior surface of the posterior arch, you will find the grooved area just posterior to the lateral mass. On both the side you will find the grooved area, and that groove area is for the passage of vertebral artery. So from here, from the foramen transversarum, the vertebral artery will grooved around this posterior part of the arch, and that will be seen in the suboccipital triangle. Okay, so that is the area where you find the third part of the vertebral artery like this, and that is why this groove is formed. Okay, now on the lateral side, or the lateral masses consist of this facet. Okay, so that large facet which called as superior articular facet, and that facet is very elongated and concave, and when you see the direction, it is slightly medially directed. Okay, and it articulates with the occipital condyles and forming the atlanto-occipital joint. Now the lower surface of this lateral mass also bears the facet that will not seen here, but this facet are also circular. Okay, not this concave or convex, but it is circular and less flat, and it is directed also medially, and it articulates with the corresponding facet of the axis vertebra to form the atlantoaxial joint. Now medial surface of this lateral mass is marked by this tubercle. Okay, and this roughened tubercle is for the attachment of the transverse ligament, and that will supports the posterior part of the dents that will attached over this tubercle. Okay, so medial surface of this lateral mass you'll find the tubercle, and then after you'll find the transverse process, and that transverse process from the lateral side, and usually it is long and felt on the surface of neck between the mastoid process and the angle of mandible, because when you rotate your head and if you put a finger between the mastoid process and the mandible, you'll feel the transverse process of the first vertebra. Okay, not, it is not clearly visible or palpable if the neck is so much thicker due to the musculature. Okay, so that is the lateral transverse process. Okay, and in that transverse process you will find the foramen transverse area, and here the posterior tubercle is prominent rather than the anterior tubercle. Okay, and that act as an effective lever for the rotatory movement. This transverse process will act as a lever for the rotatory movement. Now, what is the attachment of the atlas vertebra? You clearly see it has the anterior root, this anterior tubercle, posterior arch and the posterior tubercle. Then it has the lateral mass, which facet bearing the two facet, superior and inferior facet. Okay, and then the transverse process and the transverse foramen. Now the attachment of the atlas. Now see this upper part of the atlas vertebra, that will give attachment to the anterior atlanto-occipital membrane between the upper part of the atlas and the occipital condyles. Okay, so upper surface or the upper part of this atlas vertebra will give attachment to the anterior atlanto-occipital membrane, while the lower surface of this anterior arch will give attachment to the highest pair of anterior longitudinal ligament. Now on the posterior side, the upper part of the posterior arch, that will give attachment to the posterior atlanto-occipital membrane, that is over here. This is the area for the attachment of posterior atlanto-occipital membrane, while this is the area where we have the attachment of the anterior atlanto-occipital membrane. Okay, while this lamina give the attachment to the ligamentum flava, the highest pair of ligamentum flava, and that will be continue as a posterior atlanto-occipital membrane. Okay, so here you will find the ligamentum flava on all the side, but on the most superior aspect it is continuous as a posterior atlanto-occipital membrane. And just on this tubercle, this medial tubercle, you'll having the attachment of the transverse ligament or the transverse band of the cruciate ligament, that will supports the posterior part of the dens. Okay, so these are the ligament attachment. You just identify this two ligament, anterior atlanto-occipital and posterior atlanto-occipital membrane on this two arch. Okay, we have here the atlanto-occipital joint will be formed over here. Okay, and this transverse foramen will traverse by the third part of the vertebral artery. Okay, now the muscle attachment on the atlas. Here you can see this is the posterior tubercle of the atlas vertebra, and that will having the origin of rectus capitis posterior minor. Okay, then you will find over the transverse process, that is origin of this muscle, that is the oblique capitis superior muscle, that is arise from the posterior part of the transverse process of atlas vertebra. Okay, while on the anterior part of the transverse process, there is the origin of the rectus capitis lateralis, that is arise from the anterior part of the transverse process. Okay, apart from that, some part of the levator scapulis also arise from this transverse process, while the foramen transversorium will traverse is the third part of the vertebral artery, which will pierces the atlanto-occipital membrane. Okay, the posterior one, and then it will go inside the foramen magnum. Along with that, we have the first cervical nerve is also related to the atlas vertebra. Okay, that is also related to that part. Now the axis vertebra. How you identify the axis vertebra? That is the second cervical vertebra. It is identified by means of presence of this odontoid process. Okay, so this is the anterior view of the axis vertebra. This is posterior view, and the presence of this odontoid process will confirm the second cervical vertebra. It is a very strong and tooth-like projection from the upward part of the body. Okay, so upper part of the body have this projection called as odontoid process, and this dens is usually believed that it is representing the body of first as well as the second cervical vertebra. This is the fused body part of the first and second cervical vertebra. Okay, now what is over the body here and the dens? Body or the dens, you can see here, this is the body or the dens. It is very tough, remarkable, okay, tooth like projection. Now superior surface of the body is fused with this dense part, and on each side it is encroaching to the superior articular facet. So on the lateral side of the body you will find the superior articular facet. Okay, the dens articulates anteriorly with the oval facet on the posterior surface of the anterior arch of atlas. So this dens anteriorly it is articulate with the posterior part of the atlas and forming the atlanto-occipital joint, while the inferior surface has the prominent anterior margin that is over here. Okay, and which is projected downwards, and that will hide the second intervertebral disc. Now what is about the vertebral arch? Here you can see the particles are very concealed one. You cannot clearly identify the particle because it is overhanged by the superior articular facet. This facet is also overhang on the foramen transversorium also, and that is why the superior vertebral notch is the shallow than the inferior vertebral notch that is seen over here. You can see this inferior vertebral notch, okay, that is more prominent than the superior vertebral notch, while the posterior the lamina are thicker and the strong one. Now articular facet, each superior articular facet occupies the upper surface of the body and the massive pedicle, and laterally it is overhangs the foramen transversorium, while the inferior articular facet is the circular, downward and forward in direction, and that is articulate with the third cervical vertebra and forming the facet joint. The transverse process of the second vertebra is very small and represent the true posterior tubercles only. So in the second vertebra only there is a posterior tubercle. There is no anterior proper tubercle. Okay, and the spine is large, and when you see it is directed downward, it is large, thick and very strong, and it is deeply grooved inferiorly. The tip is bifid and it is terminating into the two rough tubercle. Okay, so it does not having only the bifid part, but over the end part you will find the two tubercle. So that is the whole features of axis vertebra. You will find the odontoid process that articulates anteriorly with the anterior arch of atlas posterior side. Then it has the superior articular facet which articulate with the inferior articular facet of the atlas and forming the atlanto-occipital joint, that is the lateral part of the atlanto-axial joint. Okay, then here we have the facet joint with the third vertebra. Then you'll find inferiorly this prominent part, the beveled part, okay, and that will just hide the whole intervertebral disc. Then you'll find the bifid spine. Now which are the attachment on the axis? On the axis you'll see here, this is the axis or the odontoid process. Okay, so the tip of the odontoid process will give the attachment of the apical ligament of the dens. Okay, while the anterior surface of the odontoid process will give attachment to the anterior longitudinal ligament, while the posterior surface of the odontoid process will give the three ligament from outer to inside. You will find first most lower part is giving the attachment of the posterior longitudinal ligament, while the upper part will give the attachment of the apical ligament of dens. Just below that you will find this vertical band of the cruciate ligament. Okay, it has the superior and inferior band. So this cruciate ligament is also attached to the posterior surface of the odontoid process. So as a whole, this odontoid process have this anterior side anterior longitudinal ligament, posterior side posterior longitudinal ligament. In the upper part it has the membrana tectoria, Then we have the vertical band of the cruciate ligament attached on the posterior side. And rest of the odontoid process will covered by the synovial membrane. Okay, because it will forming the atlanto axial joint, which is the pivot variety of synovial joint. And this is the section of the transverse ligament that will support the posterior part of the odontoid process. And the lamina of the odontoid process will give attachment to the ligamentum flava. And most posteriorly, the tip of the axis vertebra that will give attachment to the ligamentum nuchae. Okay. Same here, you can see some ligaments. Here you will find the cruciate ligament. When you see this is the odontoid process. The apex of this odontoid process will give the apical ligament of dens. On the lateral side, it will give attachment to the alar ligament also, and that will support the superior part of the atlas to the odontoid process. The posterior to that, this ligament is called as transverse ligament, and that will attach to the medial tubercle of the atlas, that will forming the transverse band of the cruciate ligament. While this is the superior band of the vertical ligament, here we have the inferior longitudinal band of cruciate ligament. Okay, and just above that you will find the posterior longitudinal ligament. Now muscle attached on the axis. So axis is having the so many muscle attachment. Mostly the deep muscles of neck will be attached to the axis, but here most prominent, the spinous process of axis will give attachment to this muscle that is called as oblique capitis inferioris. Okay, and the transverse process of the axis vertebra that will give origin to the this rectus capitis posterior major. Okay, sorry, this one, the transverse process, the spinous process will give two origin. One is the rectus capitis posterior and one is the oblique capitis inferioris. While the transverse process of this axis vertebra is also giving the highest origin of the sclenus posterior. Okay, its posterior tubercle will give origin to the sclenus posterior, while the lower part of the spinous process will give origin to the interspinalis muscle. Apart from that, it is also giving the attachment of sleep of the semispinalis cervicis and the thoracic also. Okay, and so much the multifidus is also attached by means of second cervical vertebra. Now what is the atlanto-axial joint? The present between the atlas and the axis. Okay, so odontoid process of the axis will articulate with the posterior surface of the anterior arch of atlas, will forming the atlanto-axial joint, and that will cover posteriorly by means of transverse ligament, that is the transverse band of cruciate ligament, and that will forming the pivot variety of synovial joint. And this lateral part which articulates with the condyle of inferior condyle of atlas and the axis will forming the lateral atlanto-axial joint. Okay, and so many ligaments are giving support to the atlanto-axial joint, and rotation movement possible at the atlanto-axial joint. So that is the no movement possible at the atlanto-axial joint, while yes movement will be present on the atlanto-occipital joint. Okay, so that is clear about the joint. Now what is the clinical anatomy related to the atlas and axial vertebra? So first, in the judicial hanging or during the suicidal attempt, if person will hang her neck or his neck to some overhanging part or the object, there will be the fracture of odontoid process, and this fracture fragment will go towards the foramen magnum, and that will compress the mostly the respiratory and the heart rate center over the pons, and that will block the pons properly, and that will cause damage to that center and will leads to the death of the person. Okay, so fracture of the dens is very complicated and very dangerous. It will leads to hitting of the pontine center of the respiration and the heart rate, and that will cause sudden death of the patient. Same here, the retropharyngeal or the pharyngeal inflammation, because this is the atlas vertebra, anterior to that you will find the pharyngeal or the retropharyngeal part. Okay, And retropharyngeal inflammation will cause decalcification of this anterior arch, and this decalcification of this anterior and the lateral part of the atlas vertebra will leads to stretching of this transverse ligament, and stretching will leads to rupture of transverse ligament, and that will cause dislocation of odontoid process from its joint space, and that will cause compression on the spinal cord, and that compression is also leads to sudden death of the patient. While the atlas vertebra will sometimes fused with the condyles of the occipital bone here, and that condition is called as occipitalization of the atlas, and during that condition the occipitalized atlas vertebra that will cause compression over the foramen magnum and leads to compression on the upper part of spinal cord. While here you can see here, this is the occipitalization of atlas vertebra, and you will see the narrowing or stenosis of the spinal cord. Okay, here you can see the axis will be going towards the foramen magnum. Same here, the hangman's fracture is what? The fracture of the pedicle is called as hangman's fracture, and that will leads to dilatation of the vertebral canal. So no compression on the spinal cord will be seen, but there is a dilatation. Okay, that will cause the some irritation or nerve injury related to the spinal nerve. Now the seventh vertebra, it is also called as vertebra prominence, because the identification of this vertebra is just because of its prominent spinous process. That is why it is called as vertebra prominence. Okay, and through this, the tip of this spinous process, we can identify the clear-cut demarcation of the neck and the thorax. So whenever you find, if you flex your neck and you'll find the knuckle furrow around that, and you feel the most prominent spinous process, that is the seventh cervical vertebra. And through this vertebra you can count the cervical vertebra upward as well as the thoracic vertebra downward. Okay, now transverse process is comparatively very large in the size, and posterior root of the whole vertebra is larger than the anterior one. Okay, so that is here, this posterior root is larger here than the anterior one. Sometimes the anterior root will be absent here. Okay, and only the posterior tubercle will be seen. The foramen transversarium is smaller one. Sometimes the two foramen transversarium will be seen. Sometimes there is an absence of the foramen transversarium. Okay, and this foramen transversarium does not contain the vertebral artery. So this is all about the seven cervical vertebra. The body is resembles of the thoracic one. Okay, so now onwards you will see the thoracic vertebra will be started. So this is the transition of body from the cervical to the thoracic one. Okay, so that is why the small heart shape will be seen over this body. Okay, here do not see the beveled part anteriorly as well as on the lateral side. The superior articular facets are the flat one and mostly directed backward. Okay, the lamina is slightly thicker and more thicker on the lower part rather than the upper part, and it has the clear cut, the prominent spinous process. Okay, now some attachment on the seven cervical vertebra. The tip of the transverse process will give attachment to the ligamentum nuchae. Then it is also giving insertion to the trapezius muscle. Then it also giving the origin of splenius capitis and splenius cervicis muscle. It also giving attachment to the rhomboides minus and the serratus posterior superior muscle, as well as some deep muscles of neck is also attached to the spinous process and the transverse process of the seventh cervical vertebra. Now sometimes the anterior root of the seven cervical vertebra get enlarged and forming the rib, that is called as cervical rib. And if the cervical rib is present, this costal element of this rib or this vertebra will give the cervical rib, and if cervical rib is present, that will give the compression over this three structure, that is the brachial plexus, brachial artery and the brachial vein, and that will leads to the thoracic outlet syndrome. Okay, because this will give compression to the trunk of brachial plexus, and that is why neuropathic symptoms will be seen, as well as subclavian arterial occlusion will be seen. Okay, so there is trophic changes that occur over the hand and the arm of the patient. So that is called as symptoms related to the thoracic outlet syndrome, and that is because the costal element of the 7 vertebra will forming the cervical rib. Okay, the extra rib present on this from the cervical vertebra. So this is all about the atypical vertebra. Thank you so much.
Thank you.